Good morning. My name is Brenda Zedaradido. This morning, I want us to have a discussion about cancer awareness. The month of October every year has been set aside as a month of talking about cancer awareness, specifically breast cancer. But this morning on KTN News Center, we're not only going to be focusing on matters breast cancer, but the different types of breast cancers, how to know the signs and symptoms, the treatment, and also how to overcome it and become a victor. And this morning in our discussion, we have the experts, doctors, and also a cancer survivor. But let me begin with the cancer survivor and give you her profile. That is Violet Havele Shunza, a cancer victor. She was diagnosed with colon cancer in the year 2017. Now, Violet underwent surgery and a colostomy was fixed. She also went through 12 cycles of aggressive chemotherapy. Violet is cancer-free now as we speak, currently doing cancer advocacy in Western and North Rift regions of Kenya. She also volunteers with the Stoma World Kenya. That is the story, the profile of Violet. Now, I need to bring in a medical expert in this conversation. That is Dr. Anne Nyawira. She is a medical officer in charge at the Nairobi Women's Hospital, Naivasha branch. Let's get a look at her profile. Dr. Nyawira is a licensed and registered medical practitioner working at the Nairobi Women's Hospital, Naivasha branch as the medical officer in charge. She oversees clinical services at the branch. She is also passionate about promotive and preventive health education at the community level. So apart from Dr. Anne Nyawira, we also have another doctor, that is Dr. Angela, and she is a medical oncologist. This is her profile. Dr. Angela Makigeyo is a licensed physician and a medical oncologist practicing in Kenya. She has Masters of Medicine degree in internal medicine at the UON. She also has a Master's in clinical oncology from Ulm University, that's in Germany. She has a fellowship in medical oncology from University of Nairobi. She is a member of the Kenya Society of Hematology and Oncology, also known in short form known as KESHO. She is a member of European Society of Medical Oncology. She's also a member of American Society of Clinical Oncology. She is also a fellow of the East Central and Southern Africa College of Physicians. Such a rich profile for Dr. Angela. So I have two medics with me here to discuss with me about matters to do with the cancer. So let me begin with Dr. Anne Nyawira. So October is a month of talking about cancer awareness, but specifically it has to do with breast cancer. We shall be talking about, different types of cancers. But let's begin with this month of October. Why just focus on breast cancer?
We need to focus on breast cancer because of the increased prevalence. If you compare the statistics from the year 2012 and statistics from the year 2018, we have seen a rise in the number of newly diagnosed breast cancer cases by 2,000. In 2012, we had about 4,000 newly diagnosed breast cancer cases. In the year 2018, we had 5,985 new cases. So we can see that the cancer incidence is on the rise. So we really need to be on the lookout and increase awareness at the community level so that we are able to pick these cases from an early stage.
All right, thank you, Dr. So let me bring in Dr. Angela. And Dr. breast cancer is one of the cancers that has been termed as the leading cancer, especially in women. Let's talk about the age, of where most cancer cases, breast cancer cases, have been reported.
In the Western world, so I'll start with the Western world because they have a more robust database. So in the Western world, breast cancer cases tend to occur at much older ages of over 50 to 60 years. Whereas in Kenya, we have a lot less data on the epidemiology of breast cancer in our population. But we have two studies done, one at the Kenyatta National Hospital and the Nairobi Hospital, that is showing the median age to be quite similar to that of the Western world. So most of our cancer patients come at 50 years and above. On the other hand, when we look at our practices, then we see lots of young patients in their teens, in their 20s, and in their 30s coming with breast cancer. So much as we want to go with the big facilities, this is the Kenyatta National Hospital and the Nairobi Hospital data, I think we need to look at our age across the country so that we really get a more clear picture on the median age in Kenya. So that is not very clear, really, because of poor data.
All right, so let me bring in, a story by one of our own guests, that is Violet. Violet, talk to us about, the journey, how this all began and how you got to find out that you had cancer.
Thank you so much. First of all, it began as just simple stomach pains, and bloating was also part of it. And then as I advanced on, actually the cancer was there, I think from 2012, because the symptoms started in the year 2012, but I didn't quite look at it as it would be cancer or something of the sort. So I visited various hospitals, and they'll just treat me of other illnesses like ulcers and other stuff. So in the year 2015, 2016, the situation became so worse and I lost a lot of weight. I think I was actually 36 or 38 thereabout. And then in 2017, the situation was very bad. I could not walk, I could not eat, I could not do anything. And I went to Kenyatta Hospital, and they did some tests, urine tests, they did blood tests, and then they did a CT scan, and it showed that I had a pelvic abscess. And I was just to go to theater, and then after there, I would just go home maybe after 2 or 3 days. But when I got to theater, the surgeons who were operating on me were actually shocked because they got a colonic mass. And they had to call in general surgeon because I think the gynecological surgeons were the ones who were doing the operation. So they called in a general surgeon who fixed a colostomy. And I was out of theater, and when I got to the ward, that is actually when the nurse told me what was done to me. I didn't even know, because I woke up and I found something hanging from my stomach. I didn't know what it was. So, sorry?
All right, as you're trying to, fix that technical hitch that Angela is experiencing on her side, let me bring in a Dr. Okay, Angela, I believe now you're okay. Kindly unmute your mic so that we can hear you. Violet, kindly unmute your mic.
Yes.
You were talking to us about you coming to find out the situation through the medical nurse who was attending to you.
Yeah. So after the nurses told me about what was done to me, how they fixed the colostomy and stuff like that, they advised me, gave me a bit of counseling, and then I started on chemotherapy.
All right. So let me bring in Dr. Nyawira. Basing on Violet's explanation on how she came to find out that she had colon cancer, and that is a major concern on some cancer patients, how the news is broken to them and being told you have cancer. Is there a better way on how medical staff can do that?
Yes, there is a better way of detecting cancer, not just breast cancer. And the one way of actually picking up these cases is by getting a proper history from the patient, the family social history, getting to know them as a person, and finding out whether there is anything unusual they have found out about themselves despite the symptoms that they come to you with, and then doing a proper systemic exam. You will find that most of the breast cancers are diagnosed incidentally. You will just find something unusual, an unusual finding during a chest examination. And I think it's very, very, very important that us as medical practitioners actually get to expose these patients, examine them from head to toe every time they visit the facilities.
So let's talk about a situation, because you see, for Violet, she had colon cancer. She didn't know about it. She only had symptoms. So even after the operation was done on her, she wasn't told that she had cancer. She only got to know it through a medical nurse who broke the news to her in a way that she didn't expect.
Yes. Well, actually, I will say that, again, this goes back to getting a proper history from the patient, getting to know them at a very deep level, getting to know, to identify risk factors from early on during management of patients, and again, still very, very important, doing detailed physical exams.
All right.
That will help identify these cases very early.
All right. So, Doctor, let me bring in Daktari. So let's talk about different types of cancers that we have. So far, we know, the common one that women talk about is cervical cancer, breast cancer. Then you also have, the colon cancer that Violet has talked to us about. So Daktari, talk to us about different cancers that are there.
So, usually the word cancer is used as almost one disease. If you talk to patients, they will tell you I was diagnosed with cancer, but we know that we have over 100 different types of cancers. And the commonest ones, cancer, prostate cancer, colorectal cancer, esophageal cancers, those are the top 5. But we have about more than another 95 different types of cancers. And cancer is quite complex because when you talk about breast cancer, it is still heterogeneous. It is not one disease. You'll have almost 4 different types within breast cancer. When you talk about colorectal cancer, then you have the colon cancer, and you have the rectal cancer. When you talk about sarcoma, you have over 60 different types of sarcomas. So cancer is it's really quite complex and quite heterogeneous. And it is not one disease, and that makes it very complex because each cancer is managed, let me say it is prevented and diagnosed and managed in very different ways. So cancer is not just cancer.
All right. So when you're talking about these different types of cancers, talk to us about, ways of how someone can actually get cancer, because so far we know people, when you're talking about cancers, you're told about eating healthy, exercising, and also just ensuring that you keep a healthy lifestyle. So what are the causes of these types of cancers? When you talk about breast cancer, what causes it? When you talk about cervical cancer, what causes it? When you talk about prostate cancer, what causes it? When you talk about colon cancer, what causes it?
So I'll start with a general overlook where we have hereditary causes of cancer, what we also call familial causes of cancer. And these ones tend to occur in children and in young people. So when I see a child or a young person with cancer of any type, then I'm worried about a familial or a genetic or a hereditary cause of that cancer. But usually only 10 to about 20% of cancers are familial. We have the next group that forms the bulk of cancers. About 80% of all cancers are what we call sporadic cancers, meaning that much as the cause will be genetic, there will be a change in the genes of that person, but the changes are not caused by a hereditary condition. It is caused by first, failure of the body to repair errors that happen when cells are being formed to replace old ones. So if you have errors occurring, and they're bound to happen in all of us, then those errors do lead to cancer. And this can happen to you even without exposure to some of the environmental factors that we know about. Many times when you talk to our cancer patients, try and trace what it is that gave them cancer, you'll find that they've never smoked, they've never taken alcohol, they did not have HPV infection if it is cervical cancer. They eat well and they exercise. And if you ask Violet, you might find that in her history, she doesn't have any of those. Colon cancer is also linked with obesity, and you'll find that someone is very obese, but they get colon cancer. So there are those sporadic organ mutations, causes of cancer. And then we have the lifestyle ones we alluded to.
All right. So let me bring in Violet. Violet, we've had it from Daktari, the causes of cancer. From your history, talk to us about, probably was it your lifestyle or was it from your family lineage?
Well, I wouldn't say it is from my family lineage. It's not genetic, because I was actually the first one that was diagnosed with cancer in my family. And I wouldn't also say that it would be because of my lifestyle. I'm not a smoker. I don't drink alcohol. So I wouldn't say it's also associated with lifestyle. No. But when I was a child growing up, I was very obese. So when I was told colorectal cancer, one of the causes obesity, then I tended to imagine that maybe it is the obesity that caused it.
Mm-hmm. So by the time you're being told that you had cancer, before you were told that you had it, actually, what was your kg? What were you weighing at that time?
By the time I was told I had cancer, because I suffered for quite some time, I think for a year. So I was at around 40-something kgs.
All right. So, Dr. Anne, Dr. has explained to us, and also we've had it from, Violet, about the causes and how someone can be told, the reason as to why you've gotten these cancers. Let's talk about the treatment, let's begin first with colon cancer that Violet has talked about.
Well, colorectal cancer, you want to know about the treatments? There are many. And the types of treatments, the common treatments cut across all cancers. Number one is surgical resection of the tumor itself, and this is usually followed by radiation and then now chemotherapy. Though there are cases whereby the tumor is so large, you have to do what you call neoadjuvant chemotherapy. That is, you give chemotherapy before the surgery to reduce the size of the tumor, and then you do the surgery, and then this is closely followed by radiation.
All right, so is it then, okay, kindly finish your statement.
Yes, then specifically for breast cancer, there are other avenues to explore, and especially when it comes to the hormonal treatments, because the breast is a hormonal tissue. Okay, it has estrogen receptors, it has progesterone receptors. Yeah, so we have a chance to work with another way of treating apart from surgical, chemotherapy, and then radiation.
All right, and when you talk about chemotherapy, anytime someone has been told, you've been given that medical report that you have cancer, the first thing that runs into your mind is chemo, and people have, the negative thought about chemo. So is chemotherapy, a treatment for all types of cancer?
Well, chemotherapy cuts across almost all the types of cancers. Dr. Angela will specify on this, as this is her specialty. Though it cuts across all the cancers. The specific chemotherapy regimens vary from cancer to cancer, right? We have a specific regimen for colorectal cancer, we have a specific regimen for endometrial cancer, we have a specific regimen for breast cancer. So yes, chemotherapy actually is a mainstay of therapy when it comes to cancers across.
All right, so Dr. Angela, talk to us about the treatment of chemotherapy, and also when you're talking to us about that, when we talk about breast cancer, there is an option that women are given, and that is a surgery, to cut off the breast that has been affected by cancer.
So usually cancer is a very multidisciplinary disease, so you cannot manage cancer as one specialty. You need your surgeon, you need your radiation oncologist, you need your medical oncologist, you need your counselors. Violet got to be told about colon cancer a bit haphazardly. So you need your counselors, you need your physiotherapist, your occupational therapist, because you have both the definitive treatment and you have the supportive treatment. So surgery is very useful and can be curative for very small cancers. And it's really the one sure known way to cure cancer. If you can go in and cut out all the tumor without leaving any tumor, but also without compromising organ function for a particular patient. So breast tends to be very easy because it is more cosmesis. You can get out the whole breast without losing function. What happens is just that the lady may not feel comfortable if there's no proper prosthesis or reconstruction. But for most other organs, as you do surgery, then you have to look at, can I get the whole tumor out without compromising the function of that organ? Now, other than surgery, which is the more curative way, then there's chemotherapy, as Dr. Mutugi has mentioned. And chemotherapy can be given before surgery to shrink tumor so that it is much easier to remove fully. It can be given after surgery once the tumor has been removed to clear any circulating cancer cells in the bloodstream. Because remember, as you cut out the tumor, cancer cells do get into the bloodstream, and the way to get that fixed is by giving chemotherapy after. But we also give chemotherapy palliatively to our patients who have stage 4 cancer. We have no hope for cure, but we want to improve their quality of life. So we give that really just to control symptoms and give a better quality of life to patients. I've said cancers are very heterogeneous, and the protocols you use for head and neck are different from those you use for breast, and they're different for those you use for liver, for colon, and they are so diverse that we cannot go through them all.
All right.
And it's just important to always counsel the patient appropriately on the benefits versus the risk of going through such an intensive treatment. It is really not easy for the patient. All
right. And Dr. just before I bring in Violet, and you know, there are people who say that I'm cancer-free, you went through chemo or a surgery was done, and years later or months later, you hear that the cancer has reoccurred. Why?
Well, usually because, as I said, all cancers, whether they are familial, whether they are sporadic, are due to genetic changes that occur in the body as cells form and as they are destroyed. So when you do surgery, you remove the tumor, yes. When you give chemotherapy, you kill the circulating cancer cells, yes. But remember, the genetic cause for that cancer is not handled by that treatment. And if our patient has good immunity, and many times we actually just aim to reduce cancer cells during treatment to below 1 million. Because below 1 million cancer cells in the body, your immune system, if it is robust, will kill the remaining cancer cells. But if the immune system is not robust, even after surgery, even after chemotherapy, cancer can stay in remission. So mostly we say it is in remission because it is not showing, but we know that the cause has not been managed. So years later, a patient who is in remission with very few circulating cancer cells in their system that maybe were not eliminated by the immune system, if something happens to them to stress them, be it anxiety, be it infection, be it poor immune system due to a disease or to other medication they are taking, the cancer can flare and begin to grow again. And now that is what we call a relapse or a recurrence.
Okay, so
once you've gotten cancer, you can get it again.
So, Dr. what you're telling us here is that also the immune system of a person plays a critical role when fighting cancer.
Yes, because we never clear all the cancer at end of treatment. So your immune system has to be really, really good to clear it for you and to remain good for the rest of your life. If it doesn't remain good at some point in your life, you may get that recurrence.
All right. All right. So, ladies, allow me to take a short commercial break. We'll be right back with Dr. Angela and Dr. Anya. We're also Violet, a cancer-free patient, just to talk to us also